In this video, NSUN Chair Angela Newton talks us through the 4PI involvement standards, a key policy development for NSUN and a framework for involvement in mental health service delivery and planning.
Hi, my name's Angela and I'm the Chair of the National Survivor User Network. I'm really pleased to be able to speak to you a little bit about 4PI. And when I say 4PI, you're probably wondering what on earth is that? But what it is National Involvement Standards for Best Practice in Service User Involvement, or Service User Leadership, or Co-Production, or Service User Engagement, or the many, many words that are associated with that way of working. Essentially, it's all about making sure that people who are using mental health services, as well as other kinds of health and care social services, are able to advise people and organisations about the best possible way for their voice to be heard. So in terms of 4PI, I've got quite a lot of insight into that from various different places. I think the most important one is to say that I've worked with and alongside hundreds, probably thousands and thousands of people now who are using mental health services or have done, who've experienced distress and have been involved in being able to shape services for the better and for the future. And I've seen some brilliant ways of working and I've seen some pretty awful ways of working as well. And when 4PI was being developed quite some time ago, so a few years back now, I was part of a group of exceptionally brilliant people who had had so much insight into that way of working and that way of being, because actually they'd been at the hands of organisations who were working in that kind of way. And they knew themselves what was the best way of doing it, what was the worst way of doing it, and everything that sits between. And for me, that's why the 4PI framework is really important, because it's been developed by people who have that insight, who have used services themselves and who've had that kind of experience of knowing and of really, really knowing what works and what doesn't. 4PI stands for 4 Ps and 1 I. So for the Ps, it's around the principles of involvement. The next P is around the purpose of it and being really clear about what that is. The next P after that is about the presence, about who's in the room, what are the people who you need to be able to be involved in saying something. And then the fourth P is around the process, the way in which things need to happen. And all of those are equally important. And the I within 4PI stands for the impact, and knowing that, you know, what difference is it making if you're asking people to have a say about an inpatient ward or a child and adolescent mental health unit or an eating disorder unit or a community mental health service or a counselling service. All of those things are equally important, and when you come together, when they come together, then there's a process by which you can work through. And I know from the conversations that I continue to have and the experiences that I continue to hear from people who are working within and alongside colleagues in the NHS, voluntary sector, private sector, that actually the way in which people are involved still isn't good enough. People still have really bad experiences of being cherry-picked, of not being supported to have a conversation within a meeting, of not being listened to, of not being heard. And sometimes that can be really tiring, and it can be really exhausting, and it can be really frustrating as well. So I think they're as relevant now as what they were a couple of years ago. And I think maybe the language around that is really important to note as well. I've seen firsthand from working in a national organisation about how you can embed 4PI from kind of the top level of governance and senior management and leadership right the way through to frontline services, everything that sits in between. And really, really importantly, and quite often forgotten unfortunately, is about how people are involved in their own care and their own treatment and their own support. And that in itself is just hugely important and really valuable. And I think the more creative you can be with involving people, the more you get from it as well. But that also takes time and it takes effort, and sometimes it takes resources. But more often than not, it takes commitment, and it takes commitment from people for on to doing the best things in the best possible way for the right reasons to get the right results as well. And so if you spend time thinking about how you're going to involve people, talking to people about how they might want to be involved, and then actually going forward with that process and making sure that you've got the resources, and quite often by resources I don't mean money, I mean time, and I mean respect, and being able to work with people on their terms, you get way more out of that experience. And as a result of it, of course, you get better services as well. Services that are more aligned to what people need, what people want, and absolutely what people deserve to be able to access as well. So for me, if you involve people in the best possible way, it makes so much sense. And on the website, you're going to find a whole range of resources that can help you step by step. You can dip in and out of, and you can play about with until you get involvement right. Thank you.
You can find out about the history of 4PI, see who is signed up, and view case studies and more at www.enson.org.uk/4PI-involvement-standards.